care, and I want to make sure that we get this in, because we understand that Meharry has done quite a bit in terms of teen or adolescent pregnancies and whatnot. How intimately connected are you with some of the programs that Meharry has dealing with perhaps counseling young persons or dealing with the whole question of teen pregnancies?
Well, our nurses are involved in the clinic areas and in helping to do that. We also have been recruiting for a nurse midwife, and we have one in mind. We've had several nurse midwives at Meharry who also do the prenatal care and also for teen pregnancy. And I feel that's something that's going on, that has been going on. The other area I want to mention to you is our psychiatric services. They are excellent as far as teenagers, and also our drug and alcohol program. We also have a mental health center that is there, and anyone can call if they're in need of mental health services. One of the other areas that if you are critically ill, we have a critical care unit. Our nurses are able to provide all of the basic care for a critically ill person, and they're on monitors, heart monitors. And also, our physicians work very, very closely with all of our nursing and nurses staff.
Very good. One thing we've often talked about on this program has to do with drugs and substance abuse. What are some of the things that are told your nurses in terms of dealing with drugs and substance abuse, and do you have that as a major problem? I think it's one of the areas that certainly you provide services in. Why don't you give us as much information as you care to give us concerning drugs and substance abuse and how the nursing population is playing a part in that whole area?
Well, right now we have nurses that are counselors, and they provide counseling for the substance abuse patient, and we have an inpatient program, and we also have an outpatient program. Our nurses, by and large, have counselors. I have not had the problem with the nurses being abusers themselves, and that's something people often ask. There are many programs in Tennessee if this would happen, but we are open to all nurses, and we certainly have an active recruitment program right now. We have 2 nurses that are nurse recruiters, and they go to all of the conferences, they go to all the schools, high schools as well as colleges, to provide services to let people know about Meharry.
Well, how successful have you been? Of course, you're sending them out and trying to recruit, but how successful have you been in terms of your recruitment efforts? What do you think that you have to do in order to improve that?
Okay. There are a lot that we need to do to improve it, but I feel we've been very, very successful because people are looking at us. It's a teaching hospital. It's a hospital that certainly you'll see a lot of diseases that you may not see at any other hospital. So our nurses, we're beginning to get more nurses to come in. The track record for the nurses that are there, I find that that's been very helpful. Since I've been there, I've had a lot of the nurses that I've worked with before have called and really want to come and be a part of that team. The nursing staff is very close-knit. They work closely together, and we're doing something of cross-training nurses through different services, so that's helped with our shortage.
Cross-training, why don't you explain what you're doing there?
Cross-training means that if a nurse is interested in another area, such as critical care unit, and they're qualified to be an emergency room nurse, they can work in any service. We provide a detailed in-service education program for them to go to the different areas and learn. We have brought in outside people that have worked with us to be able to cross-train people in other areas. So we feel that not only can they work in one service, they can work in several.
Very good. I think one of the things that we mentioned earlier, and I'm not sure whether it was during this conversation, but earlier we had a conversation in reference to Meharry's, and I think I referred to it as Meharry's nursing school, and you indicated that it was not a nursing school as such. Now, what's the difference between what you're doing at Meharry and a bona fide school of nursing that might be found at another institution of higher education? Is there any difference?
Okay. In 1960, Meharry no longer took students for nursing. At that time, they provided a 4-year program for nurses. So many of the nurses, there are several nurses that have graduated from Meharry before that time. We still have some of their graduates. They also had a nurse practitioner program back in the 70s. So when we talk about nursing school with credentials, we do not have that school available right now. There are other schools there in public health and in the college that are at Meharry. but we do not have a nursing school, quote, as such. They also had an LPN program before. So we envision these programs will probably come back, at least the LPN program. If and when we combine services with Metro General Hospital, they have an LPN program. This will also enhance people to go up the career ladder into being able to go from a technician into an LPN program.
That would also undoubtedly make your recruitment efforts much easier, would it not, or would it?
Yes, well, I feel that consolidation of services, and I like to call it that, will provide more nurses, should provide better quality because you're going to train them on the same level. You will find out where their deficits are or where their efficiencies are and be able to program people into areas to provide more quality care.
Very good. We've got a few minutes left here. Ms. Booth, why don't you sort of reflect upon some of the things that we've talked about, and perhaps if there are some things that you think that we ought to make sure that our audience understand in terms of what Meharry can provide, let's talk about those things, in addition to any other issues that you think are important in terms of what we're trying to relay to our audience this morning.
Well, I'd like to let the audience know we're a Joint Commission accredited, which is a body, a national body, and we're accredited to provide all the services, and this is something that we've always been able to do. We have a 3-year accreditation. They will be back in the fall. We also have a skill program for the elderly, just as a nursing home would be. We have a skilled nursing service. The other thing they ask me often is, how viable are we? How are we doing? We're doing fine. We can provide any care that's out there for any patient. We don't have open heart surgery, but we also have a sickle cell center, which is a very it's a very good center that will screen, will provide counseling for, you know, sickle cell mainly is a disease that's found in
talk about that, because I think our audience has heard of it, but they don't understand